I was in college, I was 21 years old, and I was getting ready and looking in the mirror, and the whites of my eyes were yellow, and my skin was yellow. My roommate drove me to the emergency room. They kept me there for 5 days of doing testing. They really couldn't figure out what the diagnosis was. About 3 or 4 weeks later, I came home and there was a message there that I should call my doctor immediately. And he said, I'd like you to go to this ophthalmologist and have him look at your eyes.
The eye is a really important part of our body. If there was 1 square inch of the body that you could examine on a person, that was all you were allowed, you would pick the eye.
They found something called the Kaiser-Fleischer rings, and that is something that is characteristic of Wilson's disease, and with that, they made the diagnosis.
Wilson's disease is a rare genetic condition. It causes a problem with the copper metabolism in the body.
And the copper tends to accumulate in the peripheral cornea, forming a ring, a brownish kind of ring in the peripheral cornea.
Wilson's disease affects the liver in many cases. This copper deposition can happen in the brain as well, and that's damaging to the neurons of the brain.
The ophthalmologist can be the first one to diagnose Wilson's disease, and you can go many decades without ever seeing it, but if you are the one and you're in your A game and you find this, you've made a very important difference for someone because you've identified a life-threatening problem.
The eye is really the only place that we can directly visualize the actual blood vessels, the actual nerve fibers, and the optic nerve, which is actually the very front part of our brain. This is a nice example of the very back part of the eye. So it's a pretty fantastic place to look, to learn a lot about how our brain is working, how healthy our blood vessels are. We can see high blood pressure. We can see diabetes. We can see inflammation from conditions like lupus. We have a case of somebody who has swelling in the back of their eye. The swelling is just confined to the optic nerve here. We can see problems affecting the brain, high pressure around the brain, causing swelling in the optic nerves.
If that nerve is swollen, that can be the sign of something bad, including a brain tumor or inflammation of the nerve. Multiple sclerosis or MS can cause inflammation or paleness to the nerve.
When I look into the eye, I can see abnormal blood diseases such as leukemias, lymphomas.
We can see little cholesterol plaques in the eye. Sometimes those actually can block off a blood vessel.
So I've had patients come back to me after finding one of these plaques and, and thanking me for saving their life because their carotid artery was 99% blocked.
There's a wealth of information there, and it's yet another reason to get routine, periodic eye exams.
If my doctor did not think to go and suggest that I have this eye exam done, I definitely, within a year after that, by the age of 22, I either would have been on a liver transplant list or I would have been dead. So the fact that my life was saved through an eye exam, to me, it's amazing.